Twice a year in his Nigerian community of Ampere, Paul Dinladi makes health house calls.
Inside the net, 6.
He keeps detailed logs about the preventive medicines he distributes, makes sure each family has enough bed nets and are using them correctly, and educates his neighbors about how to protect themselves from a whole host of destructive diseases transmitted by flies, snails, and mosquitoes.
I'm 48.
Farmer and father of 8, Dinladi has been a Carter Center-trained CDD, or community-directed distributor, for almost 2 decades.
I should be up to 18 years.
And his pay for this crucial job?
Nothing, but I'm just volunteered to help my community.
It's really remarkable, encouraging, inspiring to know that for over 18 years he's been making his rounds, talking to people, and providing medicines to his friends, his neighbors, and his family. And he knows that he's making a very big impact on their lives.
All the people know them and they know everybody in the village, and so it's easy for them to talk to the people.
Adamu Salau says each community chooses its own CDDs, opening the door to a level of access and trust an outsider wouldn't have.
And because there is a trust, the people comply. And because the people comply, we are able to make progress. So the CDDs are very, very important to the success of the control and elimination programs that we are carrying out.
River blindness, schistosomiasis, lymphatic filariasis, malaria, and soil-transmitted helminthiasis. These are all diseases Carter Center-trained CDDs help their communities tackle in Nigeria. And it begins with sessions like this one.
Household number 1.
At this community classroom in Dawaki, new CDDs and ones renewing their training get a lesson in evaluating who in each household receives which medications, whether it's Mectizan donated by Merck or albendazole donated by GlaxoSmithKline, and how to determine correct dosage based on height.
I love the people of my community, and I love to see the progress of my community.
Joel Kazawa went through his first training session more than 10 years ago.
Before the arrival of this program, our people were suffering from this ailment, but our people now experienced freedom from these diseases. That's my contribution to their own success.
Communities need to be their own champions for themselves. And if you enlist them in this work, they'll sustain it, and they'll become so interested in and empowered in changing their own lives that they begin to look for new solutions. And that approach is fundamental to what the Carter Center believes and does.